Welcome to User Experience Training Part 2, Viewing Results. The goal of this training session is to walk you through how to pull results for clinical, behavioral, and situational assessments, including an overview of the test taker experience, as well as options for retesting caregivers. User Experience Training Part 1 walks you through how to set up assessments and how to send assessments out to your caregivers. So you may be wondering, how do you view those results once the caregiver has completed their assessments? There are a few ways that you can view results. One, you can have your user profile set up so that the email notification comes to your email alerting you of completed assessments. You can also view the activity of completed assessments as well as recently sent assessments from the dashboard that you're viewing here. And you also have the ability to view completed results as well as untaken assessments from the Manage tab of your Prophecy account. Before we get into viewing the results, I'd like to go over at a high level the test taker experience with you. So we'll move over into a test taker login portal. When your caregiver receives their login credentials and the login URL that they'll come to complete assessments for your organization, they'll be brought here to the test taker login page where they'll enter in their username and password and go ahead and get logged in. Once the caregiver has logged in to the test taker portal, they'll be brought to a screen where they're provided with information about the exam process. They're notified that once they select Begin next to the exam name, they're not dropped right into the exam. They're actually brought to an instruction page where they're provided with important information regarding their exam. The instruction page will launch and they'll have access to any study materials should their exam offer one. And they're also notified that all of our clinical exams are timed, allowing them 1 minute per question. They go through those questions in a linear fashion. After a question is answered, they're not able to go back and review or change the previous question's answer. If they have technical difficulties, they are able to re-enter the exam a maximum of 2 times. And then if they exceed the maximum number of re-entry attempts, their exam is scored as completed with unanswered questions marked as incorrect. We also notify them that behavioral, situational, and skills assessments are not timed. They're also provided with a technical setup instructions document to ensure that their computer, whether it be their personal computer or the computer they're using to test on site at your facility or organization, meets the technical requirements necessary to complete the assessment. Again, all of the exams are going to be listed out for them here in order of assessment type. So all clinical assessments will be listed, situational assessments, behavioral assessments, and skills checklists. And we'll go ahead and select Begin here by the Dysrhythmia with Measurements exam. So again, when the caregiver selects Begin next to the exam name, they're brought to an instruction page where they're provided with any study material, should the exam provide any, where all of our clinical competency exams, we do provide a content outline, providing the caregiver with the knowledge domains that will be covered on the clinical competency exam. The knowledge domains do allow them the opportunity to go back and refresh their knowledge on any areas prior to actually beginning the exam. If you use our annual education modules, we do provide a full and comprehensive study guide prior to the clinician completing the annual education modules. The caregiver is also provided with some additional exam information. They are notified of the number of questions included on the exam, as well as the cutoff or pass-fail score for the exam. They're also notified that they have how much time that they have to finish the exam. Again, remembering that the clinical exams, they are allowed 1 minute per question to complete all of our clinical exams. So moving back over into the exam list here, when the caregiver selects Begin next to the situational exam, they are brought to an instructional video walking them through how to proceed through the situational assessment. And then when they're ready, they'll select Begin Assessment to begin the situational assessment. Again, our situational assessment is an interpersonal competence assessment looking at soft skills for your clinician. The situational assessment is only recommended for registered nurses, and it's actually a pretty unique assessment in that it actually is 21 short video vignettes of different scenarios that a registered nurse would encounter within the acute care setting. So we'll go ahead and let this first video play just so you can get an idea of what the situational assessment will look like for your candidates.
Good morning, Mrs. Smith. My name is Beth, and I'll be your nurse today. Okay, so tell me, Mrs. Smith, how are you doing today?
I'm feeling okay. Is something wrong? I think the nurse who was in here before gave me the wrong antibiotic. She didn't seem to be paying much attention, and she kept going on and on about some party tonight.
So as you'll see, after the short video, the registered nurse would then answer the most effective and least effective response to the situation they just watched. And as a result, the situational assessment will provide you with several performance dimensions for your registered nurses. Those include critical thinking, problem solving, patient relationships, management, etc. So we'll go ahead and go back over into the assessment library so we can take a quick look at the behavioral assessment as well. So when the caregiver begins the behavioral assessment, they'll select the Begin button here. And again, they're going to get that information page there about the assessment, and then they'll move over into begin the actual assessment. The behavioral assessment has 4 different pieces that you can administer: a personality portion, a cognitive ability, an attitude portion, as well as engagement portion. And so the caregiver will walk through each section of the behavioral assessment. Going back to that exam list there, if you administer any skills checklist, they'll be the last section that the caregiver will see. And to begin the skills checklist, like the other assessments that we've walked through here, there'll be a Begin button there for any new assessments. And you'll notice for any assessments that have been started but not yet completed, the Begin button changes to Continue, and the caregiver is able to log back into the exam and pick back up where they left off on the exam, should they not be able to complete it in one sitting. So again, that's just a high-level overview of the test taker experience. So let's go ahead and move back over into the Prophecy account, and let's take a look at how to view exam results. So we're starting here on the Manage tab. From the Manage tab, you can search for existing caregivers by first, last name, full name, or email address. So we'll go ahead here and look up Nora and then select Search. So when you search, all of the applicable results will populate under the search field here. And you can select the appropriate caregiver by selecting their name in the blue font here. Anything in the Prophecy account in this blue font is clickable and expandable, so we'll go ahead and select Nora Nurse here. So once you've opened the caregiver's profile, you're able to view all completed assessments as well as untaken assessments from the caregiver profile. Now, from completed assessments, you have a couple of different options for viewing the exam results. You can either select the score percentage from the score column here, or you can create a PDF by selecting the exams you would like to view the results for, and this is going to create a PDF version of the results for you. We'll first just go ahead and select this medical surgical clinical assessment by selecting the score percentage here. So when you select the score percentage, it's going to open the test results for you in a different window, and you can view the results in HTML format. The clinical assessment is going to give you the recommended cutoff score, or the ANGOF score, which is the minimum score deemed necessary to pass this exam. We do utilize the ANGOF scoring methodology for our pass-fail scores for all of our clinical assessments, with the ANGOF score being standardized scoring seen on the NCLEX and PCAT and other standardized exams. So if your clinician meets or exceeds this ANGOF score, their caregiver score will be highlighted in a green font, deeming that they have the skills necessary for this particular specialty area. If they do not meet this recommended cutoff score or ANGOF score, the caregiver score will be indicated in red here. The clinical results page does also provide you with a score breakdown, giving you the breakdown of how the caregiver scored in each knowledge domain. And you're also presented with incorrectly answered questions and then the incorrect answer selection selected by the caregiver. The goal of this training session is really just to walk you through how to view the results. We do have a wonderful training video that walks you through how to fully interpret the results that you're seeing on each of our assessment categories, the clinical, the behavioral, and the situational. So I highly recommend taking the time to watch that training video to get more information about how to actually interpret the exam results. But just to show you here again how to pull the results in a PDF document, what you'll do is you'll select the appropriate exam, and then you'll just create a PDF, or you'll select the Create PDF with checked button there, and you'll get a green bar at the top of the screen that will allow you to view the PDF version of the results. So you'll notice here that this version you can download and save as a PDF document. And this is just taking a look at our situational assessment test result page. So our situational assessment is scored on a banded scale of A through fail. This also gives you a sub-score breakdown of the different knowledge domains covered on the situational assessment. So as mentioned, the situational assessment looks at things such as conflict resolution, critical thinking, and problem solving. And then lastly, we'll go ahead and take a look at the behavioral assessment and how to pull those results as well. So for the behavioral assessment, if you select the View option here, it's going to bring up for you the HTML version of our behavioral assessment. The behavioral assessment can be matched to several different job categories. So you'll notice that all of the RN job categories are going to be in a subsection here, or tab section of this HTML version of the behavioral assessment. If there are any non-RN categories that the caregiver can be matched to, those will be presented under non-RN, and you can also view all. And then what you'll see is going to be how the caregiver scored in the different sections of the behavioral assessment. So it's going to look at attitude. It's also going to look at engagement. And you'll notice that as you hover over the different sections of the report, it does give you detailed information in a separate pop-up window for you on this HTML version of the assessment. You can also get additional information by expanding out the attitude interview questions, as well as the engagement summary under those sections. And then there's also a section for development. So you can look at the development for new and existing employees, as well as for your nursing leadership. So we'll go ahead and minimize those sections here. And then lastly, I want to show you that from the HTML version, you do also have the ability to view the behavioral assessment as a PDF document as well. You can select a specific job category that you want to view the PDF version of the assessment for, or you can decide to view all of the different job categories that the assessment can be matched to. For this example here, we'll just go ahead and select the ICU job category, and then we'll select View Printable Version. And so this printable version is going to be a PDF version of the document that you can download and save. So here you see that PDF version of the document. Again, it's giving you that detailed information that was covered in the HTML version, broken out into the different categories covered on the assessment. Again, I highly recommend watching our scorecard interpretation training video that will walk you through how to interpret the results of all 3 pieces of the assessment tool, including the clinical, behavioral, and situational assessment. And so that wraps up this training session, User Experience Part 2, Viewing Results. I do hope this session has been helpful to you, and we do want to thank you for joining on today's session, and we look forward to seeing you over on the scorecard interpretation training video. Thank you.